Every single successful surgery begins not with a cut, but with a map. Today, we're exploring the surgeon's roadmap, the incision. It's maybe the single most critical decision that charts the entire course of an operation. It's a journey that has to be perfect, right from the very first step.
So you gotta ask, right? In this age of amazing robots and lasers, you see it all the time, is open surgery becoming a lost art? Is the simple scalpel really being replaced by joysticks and cameras?
While the answer, according to our source material, is a big, resounding no. Even with all this incredible new technology, those fundamental, hands-on skills of open surgery, they're as critical as they've ever been. It's really the bedrock of a surgeon's training.
All right, so let's dive into that very first step. An incision isn't just about cutting a path into the body. It's a huge strategic decision that defines the entire operation. It's truly an art form, guided by some very precise science.
I want you to think of the surgeon as a navigator, and the human body as this incredibly complex terrain. Their first choice is the most critical, plotting the safest, most efficient route to their target, all while avoiding vital structures like major nerves and blood vessels. If you get this wrong, the entire mission could be compromised.
And when it comes to surgical routes, there is no landscape more frequently traveled than the abdomen. It's the central hub, really. It's the superhighway that gives a surgeon access to so many vital organs.
And as you can see right here, surgeons have a whole menu of options. These aren't just random cuts. They're established pathways, like the subcostal, the chevron, or the transverse. Each one is a specific tool for a specific job, a designated route to a particular destination in the body.
But of all these options, one of them really stands out for its sheer versatility, and that's the midline incision, running straight down the center. It's the surgeon's go-to for a reason. It truly is the main artery of abdominal access.
So what makes this superhighway so effective? Well, it's all about anatomy. The midline incision follows this natural seam in the body called the linea alba. It's a line of connective tissue right down the middle where the abdominal muscles meet. So by cutting here, surgeons can gently part the muscles instead of cutting through them. And that means less bleeding and a much cleaner, more direct path. Pretty brilliant.
So you can see why it's the go-to, right? It's incredibly versatile. It offers a clear shot to almost any part of the abdomen. You can easily extend it up or down if you need to, which makes it the top choice for really complex procedures or in trauma emergencies where every single second counts.
But the superhighway isn't always the best road to take. For some destinations, a surgeon needs a more specialized, kind of local route. And that brings us to a completely different approach, the fun and stew incision.
People often call this a bikini cut. It's this low, curved incision that follows the natural skin lines. Now, the trade-off is you get more limited access compared to the midline, but for a lot of pelvic surgeries, the benefits are huge. It heals with a much better cosmetic result and a lower risk of hernia down the road.
Okay, so now let's leave the front of the body and take a little detour. What if the target, say a kidney, is best approached from the side? Well, that's when surgeons have to navigate the flank route. And this is where the journey begins before the scalpel even touches the skin. The patient is carefully positioned on their side, sometimes over a break in the table, to really stretch the flank. This simple maneuver creates a wider, more accessible surgical field. It's a perfect example of how positioning itself is a surgical tool.
And just like on the abdomen, there are multiple routes here. But wow, the trade-offs are even more stark. A supracostal incision gives you a great view, but you risk injuring the lung lining. The transcostal approach gives you amazing access, but it means cutting a rib, which can lead to more pain during recovery or even a weak spot in the patient's side later on. It's this constant, high-stakes calculation of risk versus reward.
Of course, choosing the right path is only half the battle. Once that incision is made, the surgeon needs the right tools to safely navigate the terrain inside.
Let's talk about the unsung hero of open surgery, the retractor. Its job sounds simple, but it is absolutely essential. Hold the incision open and keep tissues and organs safely out of the way. Without it, a surgeon would basically be working in a dark, narrow tunnel.
And retractors come in all shapes and sizes, each one tailored to the specific terrain. So on the left, you're seeing a Bookwalter. It's this large system that literally bolts to the table for major abdominal cases. Then on the right, that's the Lone Star, a much more delicate ring system used for super precise surgeries in the pelvic region. It just goes to show how every tool is specialized for the specific journey being taken.
So after the mission is complete, the tumor's out, the organ is repaired, the journey still isn't over. The final and absolutely critical task is to close the path, making sure it's a safe and strong recovery.
Now, this is so much more than simple sewing. Closing the fascia, that's the body's natural strength layer, requires incredible precision. Surgeons often follow the 1-by-1 rule. Each stitch is placed exactly 1 centimeter from the edge and 1 centimeter apart. This precise spacing is so critical because it distributes tension perfectly, creating a closure strong enough to prevent a hernia while the patient heals. And just as the incision was a journey down through multiple layers, the closure is a careful journey back up. From the deepest tissues all the way to the skin, each layer is brought back together. And while closing that tough fascia is key for strength, every single layer plays a role in a successful, clean recovery.
So at the end of the day, an incision is so much more than just a scar. It's the story of the entire operation, from that initial map, to the journey through the body, to the careful closing of the path. It is a testament to a surgeon's skill and foresight. It really is their signature.
And this brings us right back to where we started. In a world with increasing automation, that tactile feel, that deep anatomical knowledge of open surgery, it remains irreplaceable. So the real question for the future is, how do we make sure this fundamental art is preserved for the next generation of surgeons?